Hello everyone, we're on the corner of Randolph Road and Hewitt Road in North End, and we're outside the Solent MS Therapy Centre. The centre very kindly invited us in to have a guided tour. We're going to look into their barrow chamber. The barrow chamber is a chamber which allows them to very slowly increase air pressure to about 2 atmospheres, which increases oxygen absorption and helps with the treatment of multiple sclerosis. We'll find out a brief bit about the history of the centre, and we'll also talk to a few patients to understand how MS affects them and what the centre means for them. Now, the MS Centre is a charity, so if you would like to donate, then how to do this will be detailed near the end of the video. Thank you very much.
Because the whole ambience of the place is good. It makes you feel better.
They really do look after us.
I'm always treated absolutely beautifully, royally really.
And those girls out there, they've been fantastic.
The time to talk to you, and no one is judging you.
My name is Paul. I've been a client here since round about 1986-87. You can work out the number of years. I came here when I was first diagnosed. Within 2 days actually of being diagnosed, I came here. It seems to me is a chiropodist.
Oh, I forgot about that.
Yeah.
Oh, yes.
Because my toes are so far away now, and with the MS I can't really feel them, so it's a big mistake to try and do your own feet.
The biggest things with this centre is, I would say, the emotional support that it offers, because you can talk to like-minded people. Nobody's going to judge you. I've turned up here having had the crappiest day, feeling really awful, and I'll leave with a smile on my face, and that is worth as much as any of the therapies that they offer here.
My son Chris has been coming, we think, for about 2 years. He's got multiple sclerosis, and he finds this oxygen therapy benefits him enormously. We come all the way from the New Forest, so it's a good hour and a quarter, often more, especially with a 50-mile limit on the M27. So, you know, he's very prepared to come all that way because of the benefits that he finds.
Yeah, I'm Sue. I've been coming to the centre since 2006 when I was diagnosed with MS. I was rushed into hospital, going numb from my feet to my chest in the space of about a week. It took me a year to learn to walk again, and I have to say it was this place that scraped me out of that very dark place that I was in at that time. The oxygen therapy that I have usually weekly has helped me to manage the condition, because of course you can't cure it.
It was the start of things. We were one of the first centres to open, and Dr. Philip James, whose baby this was, and all the others as well, he arranged for Vivian Neves, who was a model and who had MS, and so she came down and opened it and went in the chamber. I'm not sure what happened to her, I'm afraid. We used to get up to all sorts of shenanigans, I have to say, just to get money. We used to have a nurses' race round Portsmouth. Needless to say, hardly any of the nurses were actually nurses. In fact, hardly any of them were even women. But they had prams and all sorts of things. I mean, unfortunately the council put a stop to all that sort of stuff now, but because we used to go into pubs and there would be, we had 2 police women here who were both had MS, and they dressed up as convicts, and when Commercial Road was actually open, as it was, you know, a normal shopping centre, they went in each shop and held them up. How they got away with it, I shall never know.
Hello, welcome. I'm Claire, I'm the Assistant Manager here at the Solent MS Therapy Centre. This is in unusual circumstances, obviously at the moment we're under the corona situation, but we ask you to come and wait in the courtyard until we call you into the building when we're ready to receive you. But come and enjoy a bit of time in the garden out here until we're ready to come in. So we'll come through. So this is our therapy centre. We have a little reception area here where we have people who will take bookings and answer the phone, all that kind of thing. Some very accessible toilets that are very easy to use for our clients. Come through to our main area. Unfortunately, this is not like it would normally be, because normally we would be encouraging people and carers and visitors to stay, have a cup of tea, enjoy some social time, which I think is very important for carers and clients alike, to have a bit of social time, because for some people this might be their only outing of the week, and it's just very important to see other people, chat to different people, and just enjoy a bit of social time. But sadly at the moment this is very different how we would be operating at the moment. And this is our Barrow chamber here, where people come in and have high dose oxygen therapy under pressure in the Barrow chamber, where they can go down to the pressure of the equivalent of either 24 feet or 33 feet, which is 1.75 or 2 atmospheres if you want to talk like that. And they're in there for about an hour and a half, as it takes a good 10 minutes to get to pressure, then an hour of treatment, and then the 10 minutes to come back again. Or for those who do not like going in the chamber, or for some medical reason can't go in the chamber, we are also able to have the high dose oxygen, but via a portable oxygen machine, which is a little bit more flexible and a little bit easier to have. You just wear a little nasal cannula up your nose, and you can have just sitting quietly in the corner having that. But for some people that's a preferred option rather than going in the chamber. And then we have 2 other rooms that we offer other alternative therapies. So we have a room that's being used at the moment for massage, reflexology, shiatsu, physiotherapy, an osteopath and a chiropodist. They take their turns to come and operate in that. And our other room is used for the portable oxygen machine. Okay. The non-MS conditions are really varied, but I would say the biggest group would be those with cancer. We've had several, we've had strokes, fibromyalgias, ME, chronic fatigue, sports injuries and broken bones and things like that. That's almost visibly, you can see them repairing very quickly. Even in the time I've been here, we've had a few people with burns, and almost before your eyes you can see their skin is healing. So for things like that, it's a very obvious, quick healing process. And for others it might be a longer healing process or just an ongoing treatment, but it will certainly give you a boost of energy, help with the healing process, helping repair all your blood cells and things like that. So it has many varied benefits. The Solent MS Therapy Centre is a registered charity, and we have been going for 35 odd years, and we are totally reliant on our own fundraising efforts and the donations that clients pay for their treatment. So we do not get any funding from any of the council, lottery or any of the other major funders that might help us out. Obviously Corona and the lockdown has had quite a major impact on our income. The major one being that our reduction in the capacity of the number of people we can treat, and obviously that has had a huge impact on our income coming in. But we are working hard, and we have reopened our eBay shop, so feel free to have a look at that and see if there's anything on there that takes your fancy. We have a lovely Facebook page, and a website, so feel free to look at our website, which has got all the links to all the other things like the eBay shop, our Facebook page, our Twitter page, all that kind of thing is all linked from our website.
Great big chamber out there which weighs 12 tonnes. That was bought from Hasler, bought it over from Hasler. The Navy bought it in on a low loader, and I think it was the REME had a massive big lorry, a massive big crane on a lorry, and of course we had to take the roof off and drop it through here.
So this is inside the barrow chamber. As I say, it has got 7 ports, but at the moment we're only putting a maximum of 3 people in at a time. So we have 2 tubes, we'll just secure them in. So that being 1, and this being our second one. Which is always a little bit tricky to put on. And we ask people to wear a little mask like this over their face, and they get secured to one such tube is the oxygen. So when you breathe in, the oxygen will come out, it's on a valve, and on the other side is the exhaust air, so that just gets pumped back out into the garden, so you're not got increased levels in here. And it takes about 10 to 15 minutes to get to the right pressure, because we go very, very slowly to about 3 feet a minute, because otherwise it could hurt your ears. They get to pressure where they're either going to the 24 or the 33 feet. They put their masks on and they just sit here and relax for about an hour. And then we do the reverse procedure and then back again. Again, nice and slowly, so it doesn't hurt your ears. Obviously at the moment, with the temperature outside being very warm, it can get even hotter in here. So the temperatures change as the pressure changes. As you go down, it can get very warm, and as you come back up again, it does get a little cooler, but not a great deal. So we just have the maximum of 3 people in here at the moment. We do allow them to use their own entertainment if they want to bring an iPad or a laptop or phones or music or anything like that. But at the moment we can't offer the radio because we're not sharing headphones and things like that. But if they want to bring their own bits of entertainment, that's fine. And they can read a book, magazine, newspaper, and make themselves as comfortable and relaxed as possible.
Hello, I'm Ruth, and today I am operating our barrow chamber. So if you have a look here, you will see we've currently got 2 people in the chamber, and you can see on this gauge that we are at 24 feet. That is the equivalent of 1.75 atmospheres, which is the lower of the 2 therapeutic doses, the higher of which is 33 feet, which is up here, which we do for some of our sessions, and that's the equivalent of 2 atmospheres of pressure. What I'm looking at here is the air inlet here, which is how we let the pressure in, which is run from a system of pipes around the back of here to a compressor that's outside. So we let the air in here, which is what you'll see when that goes up, but it's too noisy to film while we do that. And then when we get to the end of it, we've got an air exhaust which we open, which would then slowly let it out. It takes roughly about 10 minutes to reach pressure. At that point, they will then have an hour of breathing the oxygen at that pressure for the maximum health benefits that they can get.
Well, I hope you found the visit to the Solent MS Therapy Centre interesting. As I said at the beginning, they are a charity and they would appreciate any donations, which can be found immediately after this summary. Thank you very much. Goodbye.